So we'll move on to case 2. So this one is a little bit different. So this is an older patient, a 77-year-old lady who had had a previous mastectomy, so a cancer on the right. She had recently been treated for a left breast cancer. So what I'm initially going to show you are the images from her post-treatment mammogram. So on this slide, what we're showing, you can see those surgical clips in the upper outer posterior aspect of the left breast on this 2D mammogram. She has skin thickening and kind of those typical post-radiation changes. And so now whenever I see a case of a breast cancer, whenever I have the benefit of the original breast cancer, I really try to take the time to go back and look at what that cancer looked like. So we'll spend a little time kind of going through how this cancer presented initially on the next slides. So here we have 2D images. So now you can see this is before her surgery. We don't have the lumpectomy surgical clips. So she does have kind of a heterogeneous pattern here, but we don't see any suspicious focal findings, no suspicious masses or suspicious calcifications on this 2D mammogram image. So tomosynthesis was also performed, thankfully. And as you can see depicted by the blue arrows here, we have still images from that same exam showing a little mass with associated architectural distortion in the lower outer aspect of the left breast. This had been really difficult to detect prospectively, and it was not visible on the 2D images. And I just again want to highlight that I've selected the most suspicious focal view here. You can imagine as you're scrolling through these tomosynthesis images, these findings, though it may look obvious here with the arrows pointing to it, as you're really scrolling through prospectively, those can be really, really hard to see. So as we go to the next slide here, this is what the profound AI thought of this case. So we could see that very subtle area of architectural distortion that though is made much more conspicuous by this depiction from the profound AI detection in this case. So the profound AI identified the mass in both views in this case. And if we go on to the next case or the next slide here, excuse me. So I mentioned that I always like to go back and look at the previous year whenever I have the benefit of those images. So now if we just take a step back and look back at how this cancer had presented initially. So when we go back to the patient's exam the year prior, this was an exam that was read as just a negative screening exam. Now, of course, we have the benefit of knowing where that cancer was. So that always makes it's much easier in retrospect to go back and see a finding. It is much harder in prospective sense to go through and pick up those findings. So in retrospect, knowing where the cancer was when we go to the year prior, we can see that that finding was actually visible on the tomosynthesis imaging. And then what I'm showing on the right-hand image here is we called it negative, but actually the profound AI saw it last year. So this is just an example, and I have seen a lot of these cases as I've gone through my practice over the last 2 years, where we might have overlooked the finding because of how subtle it was when you're going through in real time. However, the profound AI had seen it. So is this a case that we could have potentially picked up sooner? And it might be. This is just a corresponding ultrasound image from that small cancer. So this was a sub-centimeter irregular mass at the 4 o'clock position in the left breast. And on biopsy, we'll show the biopsy clip films in the next slide here, just showing that we do have the biopsy clip corresponding to that subtle area of architectural distortion. And this was an invasive breast cancer. What are the learning points from this case? So this is a small and subtle invasive breast cancer in a high-risk patient who had had a cancer on the contralateral side. You could argue that it was extremely difficult to detect in 22, and in fact, the year prior, it had been read as negative. So in retrospect, as we saw illustrated on this case, the cancer had been visible on the tomo. Profound AI saw it, and we had read the exam as negative. So this is an example of a case that profound AI could have potentially helped us to find this prior.